Hello, everybody. This is Dr. Michael Beebe with Arete Chiropractic. And today on our collaborative business series, I'm hosting Dr. Carrie Jose from CJ Physical Therapy and Pilates here in Portsmouth. Hi, Carrie. So
Hi.
thank you so much for being here. What we're going to do is just share a little bit about our businesses, what an average office visit in our offices looks like, and then talk a bit about what we're doing as we start to slowly reopen New Hampshire to keep people safe with the current virus that is on everybody's mind, COVID-19, and then what our vision is for the Seacoast as we start to emerge from this. So, Carrie, please share a little bit about exactly what it is that you do at your office and yourself and your background.
Awesome. Yeah. So thank you so much for doing this series and thanks for inviting me on. So I think this is really wonderful. So we are a physical therapy and Pilates business. And basically what our focus is on we help people, we focus on people age kind of 40 and up. The bulk of our clients are kind of in their 50s and 60s. And what we do is we help people who want to stay active, healthy, and mobile, but they don't want to have to rely on things like pain pills, procedures, surgery. They don't want to have to be going to the doctor's office all the time. They're really motivated to keep themselves healthy so they can live a long, healthy, prosperous life. So we help people like with that in a few ways. Mostly, clients will come in and they'll start with our physical therapy team and work with our specialists there. We specialize in back pain, but we help with people with a whole host of other things. And then many of them will then transition and join our Pilates program. And we love that because it's a way for them to keep their whole body strong and active, helps keep all the problems that we kind of help them with away. And then they're still part of our family. So we get to kind of keep an eye on them. Our physical therapy and Pilates team work really closely together. We talk about you a lot behind your back type of thing, and just, really helping to just keep everybody moving. And the Seacoast is such a wonderful place to be, even during COVID. It's like the weather's starting to get really nice here. The majority of the messaging is to get outside, and we have so many beautiful places to go outside, even with things closed. And we don't want any kind of pain to ever get in the way of you being able to go out and enjoy that. So that's kind of the gist of what we do.
Yeah, it's been amazing co-managing patients with you guys because it just helps people get better faster with chiropractic. So at Arete Chiropractic, we really focus on correcting spinal alignment from the top down. And the top things that we see in the office are headaches, neck pain, and head and neck injury. But the upper cervical spine is the most freely moving part of the entire spine, which is great that we have that mobility. But when we have injury, this area is most commonly affected. And so when the upper neck misaligns, the eyes aren't level with the ground, and then the rest of the body will shift and change to make the eyes level with the ground. And the body or spine compensates. And those compensation patterns occur in the shoulders, the mid-back, the lower back, the hips, knees, ankles, all the weight-bearing joints. And so while we can correct the spinal alignment, if there are other components to a body's function that aren't settling out, that's really when we flip people over to you guys to look at the muscles, the movement systems, and work on strengthening the body and spine and extremities. And it really works hand in hand. So we've been able to co-manage patients really successfully together throughout the years that we've worked together. And when somebody comes into Arete Chiropractic, it's, we take time with people and we sit down and we go through a complete health history, a complete exam, and then we see, do you have a problem in your spine and specifically in your upper neck that's contributing to your primary symptoms or complaints? And then we can take care of that if you do. And I know that you guys take a similar time with people. So what do the average visits look like for you?
Yeah. So first, we love working with you guys. What you guys do is phenomenal. We love the specialty that you have. And it's so nice when we know that a client is coming in from, someone that you've referred to us. We just don't have to worry. We know that they're getting the right care, but they're getting specialist care. So it's kind of like, okay, we can check that box off, and then we can kind of really focus on what we know best, which is ultimately movement and kind of getting that whole body working together, especially no pun intended, alignment with what you guys do. So we absolutely love working with your folks, and your patients are wonderful. So yeah, like you said, we have a very similar model. We're specialized, we're very small. So typically what happens is someone will hear about us, maybe you've referred someone, or someone will hear about us from a friend or family. And what we'd like to do first is just talk on the phone. We make sure that you are a good fit for what we do. We don't like to waste anybody's time. We want to take you in if we know we can help and if we think you're a good fit for what we do. Once we've determined that, the next step is typically to then come in and talk to our specialists. And up until this point, all of this is complimentary and totally free. So they'll come in, they'll meet with the specialist one-on-one, and the specialist will ask some more qualifying questions. And not at that point, we kind of know you're a good fit, but then it's like, where do you start? Do you start with the physical therapy team? Do you need one-on-one? Can you start with Pilates? Would you benefit from a group program? We have a lot of different offerings. So that discovery session is designed to sort of help figure out what help you need and where the best place to start in our program is. A lot of times it is with the physical therapy team first, and then at that session, we'll figure out, we'll talk about what it looks like to get started. And that's pretty much how it goes. But I love it because, we really take time to get to know our clients, because we're really we're not really in the interest of just getting rid of your pain. I mean, obviously that's what we want to do too, but we really enjoy building long-term relationship with our clients. We want our clients to know that we're kind of like a primary care, musculoskeletal provider for our clients, so they can come back to us anytime. And it all starts from the beginning, really solidifying that relationship from day one, and just building that trust, and making sure that we're only bringing people into our family that belong and that we know that are going to thrive and that we can really help. So that's kind of sort of how we work with people.
Yeah, yeah, you guys do a great job. Now,
Thank you.
you're welcome. So COVID-19, it's on everybody's mind. And as we start to slowly re-up in New Hampshire, what are you guys doing in your practice to make sure that people are safe and feel comfortable?
Yeah, so that's been really interesting because we kind of have almost like two businesses in a way. So we've been trying our best to follow the guidelines that have been recommended. So luckily, we've stayed open the whole time for our physical therapy side of the business. Patients that have been comfortable coming in person, who aren't immunocompromised, and have been able to come in. And on the employee side, we've been taking our temperatures. We've been, there's a checklist of questions to ask. Have you been exposed? Have you met with anyone who's been exposed? Do you have any symptoms? Do you have a fever? And every single day before anybody starts, we're going through all that. We have team meetings weekly just to discuss everything, but it's been going pretty well. Patients who are comfortable coming in have been coming in, but we've also been able to help a lot of people virtually, which has been pretty cool. Our clients that didn't want to come in, for various reasons, they didn't have to skip a beat in their care at all. We've been able to help them really just like this, talking to them. We can see their bodies, we can see them moving. We've actually been able to do a lot of things we wouldn't normally be able to do in the office, like help them with specific home setups. Sometimes you learn to do something in the office and then you got to go home and try to figure it out. We've been able to help them problem solve. And it really is in alignment with our mission of empowering you through movement anyway, which the ultimate goal is to get you to be able to do things on your own. And then the relationship sort of transitions to where more your guide and your coach instead of you having to see us every week. So the virtual sessions have almost been a jumping off point there. So we're not changing anything as we continue to open fully with our Pilates side, just because of fitness, and we've got small group classes. We pretty much immediately transitioned our whole Pilates program to virtual. And, people were definitely a little nervous and skeptical at first, but they've all caught on, and they're loving it. And they're just so thankful that they're able to continue with their Pilates practice, even, from home. And we're doing it a little differently than a lot of folks. Instead of like you having to kind of turn and look and see us on a screen, we're watching you. So you don't have to even worry. It's like you're right there in the studio with the instructor. So that's been some good feedback from everybody, but hopefully we will be able to open fully maybe next week. I'm not totally sure. We're kind of waiting on the governor to make an announcement, but if and when that happens, our plan is to start with private clients only, since we've already been doing that with PT. It's really, we're already set up. It's really not going to be a big deal. We have a no touch thermometer. We can take people's temperatures in the office, and we've got masks for ourselves and we've got masks for people that need it. But for group classes, our plan, unless we've been told otherwise, is going to be to start bringing people back June 1st. Our classes were already small, only 6 people, probably going to have to just knock that down to 5. And that allows us to have a group class with everyone 6 feet apart. And, people will just wait in their cars, come right in at the last minute, go down to their class. So I'm really not too worried. Because we've always been small, it's really easy to manage. And because we don't just let anyone into our family, like I said, we know everyone before they walk in the door. So there's no concern or worry of like kind of a random person just coming in who we don't know at all that maybe could have been exposed and could infect everybody. We really talk to you a lot and get to know you before you even come in. So I think it's going to be okay. So kind of, it's like everyone else, we're sort of working it out as we go, but doing our best to stay ahead of the things and be prepared. But I feel pretty confident that things will be fine.
Yeah, wonderful. And I think that it sounds like you're doing everything you can. And we also at Arete Chiropractic have been open the entire time um, during this health crisis because as an essential business, we needed to be there for people to manage chronic conditions or emergency cases. And so we've been doing a lot of the similar practices to help keep people safe and minimize risk and exposure. So we're taking staff temperatures every day. We're wearing appropriate PPE, and we are sanitizing in between every single patient, all touch surfaces. People can wait in their car. They can come right into their appointment. And then after people get adjusted, oftentimes they'll rest or recover in the office to allow the adjustment to integrate and hold better in their body. And so people can actually rest or recover in their car as well. If a person is immunocompromised or in a higher risk population, or they're caring for somebody that is, then we have special populations appointments where we further limit the number of people in the office to minimize exposure. So we're doing a lot of measures to ensure safety, but also be available for people who need it. And I think that's something that we need to start to have a conversation around is what is the vision for the Seacoast as we start to slowly open New Hampshire? And what does it look like for people to start to be more empowered about not only preventing disease, but helping their body be more resilient and optimal function? And I think that that's something we could talk all day about, but go ahead and share your vision for the Seacoast as we open.
Yeah, that's really interesting. I think people, my sense is that people are just now starting to realize that this isn't like a short-term thing and that there is going to be a new normal. So I always try to look at positives. The positives are that there is a much bigger awareness now around your personal responsibility for health in a way. So in fact, I just finished an article this morning that will be published in the newspaper, and it's called Beyond the Mask, Ways to Improve Your Immunity. And it's, everyday things like exercising, moving, getting vitamin D, getting enough sleep. I know you guys talk a lot about that. You just did a workshop on that. Um, diet, all of those things are important because at the end of the day, our bodies do have, we're equipped to fight off things. And, the best, if you can keep yourself, the best you can be, the best health you can be in optimal shape, you're going to give yourself the best possible chance at not, you might not escape from getting a virus or any other kind of disease or condition, but you're going to give yourself the best possible chance at recovering and recouping and fighting it off and getting back to your normal self as quickly as possible. So I think those are the really good things. And you both, your practice and CJ Physical Therapy and Pilates are really positioned to help people in this fight. I mean, that's all we do. Like you're helping people, you're optimizing the function of the brain. And I mean, without that, nothing else works. So you're really optimizing that so that their bodies can be functioning as best as possible. And then we're really helping people stay out of pain and keep their joints and body and muscles and everything coordinated together so that they don't have to worry about not being able to get outside and walk with their friends and exercise and things like that. Where we're doing a virtual knee workshop tonight, actually. And, that's been all the comments coming in. Like, I want to be outside. I want to walk with my friends. I can't right now because my knee hurts. And, I've been trying to do the right thing and get out and bike and start running and do things like that. And now my knee hurts and I can't do it. So I definitely see potentially an influx in our business of helping people be able to do these things as awareness starts to come to being more responsible about your own health. I think, the hopefully the world of quick fixes are going to start to fade away because I think people don't want to be, in a crowded emergency room or urgent care facility and around places where they're more likely to maybe, get sick. So I just think that's going to be good. And then also, what's been a kind of a silver lining is, we never would have done all these virtual offerings before, and we kind of got forced into it. It's not like we couldn't do it before, but that's allowing our reach to expand. Like, we've got people from 4 or 5 hours away that might not have otherwise been able to get our help, and now we're able to connect with them and meet with them. We've got someone from the UK on our workshop tonight, so that's been pretty cool too. So I think it's going to be interesting, but I think, even though it might seem really frustrating right now, I do think that the attention to personal health and responsibility is going to be a good thing.
Yeah, that's a beautiful vision. And I love how you said that we are equipped to handle pathogens and viruses in our environment. It's so important to understand that for thousands and thousands and thousands of years, the human body has been able to function and been able to fight off viruses and fight off pathogens or little bad guys that enter our body. And it is not just about, okay, well, how do we prevent contact with these viruses, or how do we prevent contact with these pathogens? But it's like, how do we now increase our body's resilience so that when we come in contact with them, which is inevitable, our body doesn't succumb, and our own immune system has the ability to, and our own immune system.
Sorry. My dog is saying hi to a neighbor.
Right?
Every time I get on a call,
Right? So it's so important to understand, like, how does our immune system actually rise to the challenge, and what can we do not just to prevent disease, but to actually increase the body's resilience. And something that chiropractic care does is, as we adjust people, we actually restore the balance between the sympathetic and parasympathetic nervous system. So the autonomic nervous system, there's the fight or flight, or your sympathetic nervous system, which is the one that you're under control when there's a lot of stress. Or there is the parasympathetic nervous system, the rest and digest nervous system. And that's where your body's repairing and healing. And unfortunately, when we are in fear or stressed, we are in sympathetic dominance. And when we get adjusted, when our spine's actually in better joint motion, so it's freeing up the interference of the central nervous system, it helps drop the body into a better dynamic state between those two nervous system controls, and helps the parasympathetic nervous system increase so that you are actually facilitating immune pathways. So getting adjusted is a huge help to making sure that the body's more resilient. And also, like you said, sleep. I just did a free webinar, which is on our YouTube channel, about sleep. And one of the things that they were talking about in our recent research study was, when you reduce your sleep by 4 hours per night, you're actually turning off some of the genes that boost immune function. And so you're inhibiting your nervous system just by reducing sleep by 4 hours. And getting a full 8 hours of sleep, you're actually helping what's called your natural killer cells, which are little cells that are the virus snipers in your body. They go around and they detect them and they take them out. And so it's so important to get good sleep, get adjusted, make sure you're getting exercise and movement, getting vitamin D, getting vitamin C, eating healthy. All of these things people are now looking for, because there is solutions out there to help their body not only prevent problems and reduce being sick, but help their body actually function better and be more optimal, so that when we do come in contact with any kind of pathogen, we're going to be more resilient. And that's my vision and goal for the Seacoast, because it's just vitally important to make sure that we start to get out of this fear state and mentality and start to enter into, okay, now how do we live with COVID in our midst, not just try to prevent it from being there.
Yeah, I agree 100%. I think that mindset is key. And I totally agree. And I empathize and understand why there is a lot of fear, but we can't live in that state forever. So I do think I'm noticing around conversations I've been having, people are starting to realize that and slowly come out of that. So I do think that's a really good thing to see, but I agree with you 100%.
Yeah, and there's no question that as healthcare providers, we absolutely understand that there is a novel virus, and we want to get through this with the least amount of loss of life possible. And we absolutely have a lot of empathy for people who have had their lives affected by COVID, and from a health standpoint. And it's everybody's trying to do the absolute best that they can. And it's just, what is the vision for as we start to slowly reopen our states and slowly start to return to a normalcy of life? We can be resources at CJ Physical Therapy and Arete Chiropractic. We can be resources to help empower people to take some control of their health that's going to be very proactive and preventative.
Yeah, absolutely.
Yeah. Well, thank you so much for spending the time and chatting with us, Carrie. I really appreciate it.
Yeah, thank you for inviting me.
Yeah.
Have a good day.
You too.